Good afternoon. Welcome to Healthcare Voters Extended Town Hall Series, Our Lives on the Line, the Hardest Hit. I'm Jaron Keith Gaynor, Managing Editor of thegrio.com. We are happy to have an extremely important conversation about how COVID-19 is impacting Black Americans across the country. Before we get started, we want to thank our first responders, health professionals, and essential workers during this time who are helping to make things a little bit safer and normal for us during this pandemic. As I mentioned, this is brought to you by Healthcare Voter, an organization committed to the fight to expand access to affordable healthcare, medicine, and vaccines, in partnership with some amazing organizations such as the Center for Urban and Racial Equity, also known as CURE, Black Women's Health Imperative, the NAACP, the GRIO, and a host of other amazing organizations dedicated to the health and upliftment of the American people. The next few town halls in this series will focus on the people and communities disproportionately impacted by coronavirus, our friends, family, neighbors, and community members who have been hardest hit by the pandemic. The series is an extension of Our Lives on the Line, digital town hall series, which highlighted the stories of people affected by the spread of the coronavirus and how we're still fighting to protect the Affordable Care Act and lower skyrocketing prescription drug prices in the face of this pandemic. Before we get started, we have to share a video of one of Healthcare Voters team members, Ishmael Bishop, who's going to tell us about why he is a healthcare voter. Check it out.
Hey everyone, my name is Ishmael and I'm on the Healthcare Voter digital team. I'm a proud supporter of Healthcare Voter because I believe that healthcare should be a human right. Right now, my family and I, just like so many of yours, are being hit considerably hard by this pandemic. My grandmother is a patient at an assisted living facility and requires around-the-clock care. I know it must break her heart not to be able to be with her children and grandchildren during this hard time, but know that the strictest of precautions are absolutely necessary to keeping her safe. And that is why I joined this campaign, to keep my family and community safe. Join me and millions of others if you haven't already. You can record a video just like this by visiting healthcarevoter.org/story and submit.
Thank you, Ishmael, for your submission. If you would like to share your healthcare story, please submit your video by going to healthcarevoter.org/story. Today's town hall will explore the devastating impacts of the coronavirus pandemic is having on Black people across the US. Black Americans have always faced disparities in health outcomes, such as the direct result of long-standing institutional racism in this country. Now, majority Black facing 3 times the infection rate of the coronavirus and 6 times the death rate of white Americans. Today, we will hear from advocates and experts about Black people's fight against and their experiences during the coronavirus pandemic, and what we all can do to hold the Trump administration accountable for putting profits and politics before Black lives. Now going to introduce our amazing panel of speakers. It's 3 of them, and I want to get through their bios before they get to speak to us. So first, have some patience. I'm going to read through these. Dr. Judy Lubin, founder and president of the Center for Urban and Racial Equity, also known as CURE. She is a sociologist and policy analyst and racial justice advocate. She is also the founder and president of the Center for Urban and Racial Equity. For over 20 years, Dr. Lubin has worked at the intersection of racial equity, public health, communications, and public advocacy. Linda Goler-Blount, president and CEO of Black Women's Health Imperative. She has served as the president and chief executive officer since 2014. Linda oversees the strategic direction for the Imperative and is responsible for moving the organization forward in its mission to achieve health equity for Black women. Jamal Watkins, vice president of civic engagement for the National Association for the Advancement of Colored People, also known as the NAACP. Watkins serves as VP for Civic Engagement, where he leads the association's efforts to maximize the Black community's participation and representation in our democracy. I'd like to open the discussion first to you three, but first, welcome to the discussion. The first question I have for you, and it really is for all of us, how have you been personally impacted by COVID-19? And I think I'll start. For me, I have a family friend who lost his mother, and she was very close to my family, and she was only 63 years old, and it was very unexpected. And I can imagine that you guys and many of our viewers have also been impacted by it, and if not personally impacted by it, live in fear and anxiety about losing someone potentially from this virus. So Dr. Lubin, I'll start with you.
Mm-hmm. Thanks so much, Jaron, for having me. So I think, yeah, everyone has been impacted in one way or another, and some more acutely, having lost someone close to you. So for me, it's been mostly the, staying in place. We did have a scare a few weeks ago with my brother tested positive for COVID-19. Thankfully, he has recovered, and so worrying about him and making sure he had access to get tested, and then also just care for family. Having to have some difficult conversations with parents and making sure that they're taking care of themselves and staying out of harm's way. I think that's been a challenge for a lot of folks as well, worrying about family members and making sure that they're safe.
Linda?
I would say the same for me. I mean, the word I would use is worry. My children and their spouses and my newborn grandson live in New York. So the family moved to New York to be with my son's in-laws, which was the epicenter of where it is in New Jersey. So that wasn't helpful. And my daughter's husband actually came down with COVID-19, had symptoms, mild, fortunately, has made a full recovery. But I think about that all the time. So I'm trying not to make them crazy with what I know, and I'm trying to be really supportive. But that's really the word. And so I check in with them regularly just to check, make sure that they're doing okay. We do family Zoom calls like a lot of people. And we just try to keep reassuring each other and helping us get through this.
Jamal?
Jaron, thank you for having me and having the NAACP in this conversation. Similar experiences, what I realize, with my family, the bulk of them are in the state of California and the state of Georgia. And those states are like night and day. You have a governor who gets it and a governor who is completely tone deaf. And so I think about my parents who are of a certain age. My mother wouldn't want me to tell her age, but she's one of the folks that they're saying, you gotta stay home. And so we have been blessed not to have it happen to our immediate family, but we have friends, loved ones, and associates and folks in our network who have either been tested positive, and in some cases, folks who have lost their lives. But the one thing that's really stark in this moment, as you can see from my background, I'm safe at home. But I have family members who, up until COVID-19, they were considered the working class. And now all of a sudden they're essential workers, meaning they got to go to the grocery store that they work at and work so that people like me can be safe at home. And so I'm struggling with this notion of class and race within my own family. There's folks who are unemployed, and then there's folks who are employed and can work from home. And then there's those essential family members who got to go out every day, put their lives on the line for us. And so it's really been this struggle around how do you keep a mental balance and an emotional balance at the same time knowing that so many folks are not in the same place as you.
Yeah, Jamal, you mentioned intersection, and I think about the racial and socioeconomic background in all of this. And when the news first hit about how COVID-19 has impacted Black Americans throughout the country in states like Illinois and states like Michigan, where predominantly Black counties were impacted the most from the virus, it was a surprise maybe to some people, at least when you look at the mainstream media, but I think to a lot of Black Americans, it kind of wasn't a surprise. Do you think the country should have seen this coming? And that's for you, Jamal, sorry.
Yeah, so let's be clear. The country, meaning the country's leadership, not only saw this coming, knew it was coming, and actually knew about the potential devastation early on. I'm talking January, February. So when we saw that some of our sitting senators decided to hear the news and instead of telling us the truth, started selling their stock off, we knew that there was already going to be a crisis, if you will. Now, by the time we learned about it, you start to see Tom Hanks and Idris Elba coming out and saying, I've got COVID-19. At that point, the powers that be already knew and had made political choices based upon, their political reality. So for the Black community in particular, and I know I'll defer to, the two other panelists here about the impacts itself, but as a Black community, we already are in a pandemic or an epidemic economically, in terms of healthcare, in terms of jobs. And so this COVID-19 has really just magnified the fact that we are a part of the have-nots. And there's a whole class of folks who made a choice early on not to do anything until it really started to hit our communities in the most devastating way.
And Dr. Lubin, I want you to speak more to the politics that are at play with COVID-19. Could you provide some more insight on that?
Yeah, so I mean, we see red state politics at play, right, and conservative politics, and historically, that set of politics has not worked well in our favor and has not enabled or opened up access to healthcare for us. So one, we also have to realize that this politics is also anti-science, and that's largely part of the reason why we see the delayed response to the pandemic. To Jamal's point, right, that leadership saw this coming and they denied it, right? For several weeks, we were hearing from the White House that this was a hoax. And so, that wasted time, in terms of testing and getting the mobilization that needed to happen at the local level to be able to respond to this pandemic. And we know when we have failed leadership, oftentimes it's Black communities that bear the brunt of that failed leadership. And we see this all across the board, in part because politics is playing such a big part of this conversation, not only in terms of mobilizing the resources for testing, for community outreach, but also in terms of even the states, right? The state level, particularly southern states where they were slow to institute stay-at-home orders, but now are quick to rush to open up and put Black lives at risk.
Sorry, my computer went down. Dr. Lubin, you mentioned anti-science. I think that's a really big piece. What is it about the Trump administration that they do not want to rely on scientific evidence? Because it reminds me of when we talked about climate change. They were also very anti policies to kind of save the environment. Do you see a connection here?
Mm-hmm. Yeah, absolutely. So this is a thread or a strand of this politics. It's Trumpism, but it was even before Trumpism, right? That so you're seeing science oftentimes is clashing with business interests, particularly large corporate business interests, and we see that in the conversations about climate change, and we're seeing that now, right, in this very moment where particularly Republican governors want to open up their states. And they're saying we got to open up for business, for economic reasons. And so they're putting profits over people. So oftentimes this is a conversation about money. And this is a pandemic, and in any pandemic, you have to center people. You have to center, you need a human-centered response, and we're not seeing that at all. And we're paying the brunt of that.
And Linda, because you specialize in Black women's health, I think we can't have this conversation without acknowledging that Black women are the backbone of the Black community. Mm-hmm. And they are also seeing some of the worst outcomes of COVID-19. Could you speak more to that?
Yeah, it's, Jamal touched on it squarely. Who are those essential workers? Who are those folks who have to go to work, who have no option, who are working in situations where their employers are not providing personal protective equipment, who are constantly being exposed to people who refuse to wear a mask? I think we've seen some examples of that recently. And then these women have the responsibility of taking care of their families and making sure that their children are homeschooled, something perhaps they never had to do before, making sure that their elderly parents are being cared for and protected and doing what they should be doing. So there's COVID-19, then there's the stress of COVID-19. And we already know, we have plenty of data that shows that Black women have elevated cortisol levels already. And so now we're seeing this even more, and we're seeing it play out in the form of intimate partner violence, mental health crises. And many of my psychologist colleagues are telling me that probably in the next 60 to 90 days, we're going to see an uptick in suicide rates. And this is, what we call deaths of despair, because people simply are overwhelmed by what has happened through loss of wages, but fear about the future and lack of control.
I like that you picked up on the mental health aspect of this conversation, because not only are people losing loved ones, but people are quarantined and they're home trying to figure out some type of normalcy in an otherwise chaotic world.
Yeah, and their homes may not be safe places. I mean, things that happened prior to COVID-19, they might have been unstable. I think about a woman who I talked to not too long ago. She was all set to move out of her home with her children, and then COVID-19 happened and she had no place to go. So she's stuck in a very traumatizing environment, and she feels trapped.
This question is for all three of you, so feel free to chime in. What are some ways that Black Americans can protect their mental health during this crisis right now?
One thing that's been working well for me, and I know a lot of folks are also doing this, is having regular check-ins with family and friends. People are using Zoom, using FaceTime, using your phone, just to schedule some of those. And I think that really helped me, especially at the beginning, where I had two people that we had regular schedules of check-ins. I think that was really critical, because sometimes we can get into this space, especially you're quarantined, you're stuck at home, and you're either stuck at home alone, or you're stuck with, you may love your family, but you can get tired of your family too. And so, who are those sources of outside connection is so valuable, and to be able to share and be honest, hopefully, with someone about how you're processing this, because this is a significant amount of change for all of us, and for us to recognize that we're not expected to be strong, that this is a moment, if there is a moment to be vulnerable, like this is the moment to be vulnerable. It's okay to say that you're sad, that you're depressed, that you're struggling, and to reach out to folks so that you're not doing it alone.
And I would say, to Dr. Lubin's point, giving yourself grace and space to process that this is not normal, that this is not something that we're used to. I know earlier this week I was triggered by the video and the killing of Ahmaud Arbery in Georgia, and then watching videos of folks protesting with automatic rifles, and not actually seeing the balance of justice in this country. And I had to give myself space to say it's okay to be upset, angry, grieve, but also, give yourself a chance to process. And I would argue that for many in the Black community, we are rooted and centered in some type of faith tradition. And so if you have to lean on that, lean on that. If it means you got to go outside and meditate and clear your head, do that. Whatever it takes to give yourself some mental space, because these unusual times are going to lift up things that are going to probably make us angry and upset, and put us in spaces that we haven't really had to deal with in this way. So at least for me personally, that's been how I've been trying to navigate, is to give myself a little space and grace for being frustrated, angry, and upset, and you leveraging the outlets to get it out.
And I would say, perspective is really important. It's not us. Media would lead us to believe it's us. My people like me, I'm an epidemiologist, talk about data in a way that sometimes gives people the impression it's because they're Black. There's no biologic or genetic determinant for this. There's no, that is not why we have higher incidence rates or mortality rates. It's many other things, but it's not us. So it's just important to know what you can believe and what you can't. And I agree, check in with your friends and family, do virtual cocktails, I personally do yoga, meditation, get away from the news, and just give yourself, I love that term, Jamal, give yourself some grace. Just say, you know what, I don't have it in me today, and be okay with that.
I also do yoga, so I appreciate that. And I'm on FaceTime with my therapist weekly too, because it's important to also seek therapy if you feel you need it.
I'm on FaceTime with a therapist. I need to check into that. That's a good one.
Get into it. We're going to segue just a little bit. We have a question on video from Rhonda. So let's pause here and so we can respond, so you guys can respond to her answer, to her question, I'm sorry.
Hi, my name is Rhonda and I'm from Baltimore. My question is threefold. I'm seeing articles left and right stating that Black counties across the country account for over half of the coronavirus cases in the United States and nearly like 60% of deaths. So I wanted to understand, how is it that our communities are being exposed to the virus more than other communities, and why are we dying at such alarming rates? Is it related to the pre-existing conditions that we talk about in Black communities, or is it because of other racial biases, like the conversations around African Americans being less likely to receive appropriate care from doctors and hospitals? I also want to understand, how can we get young people more engaged and making their voices heard to ensure that our communities don't continue to be disproportionately affected or left behind when situations like this continue to occur?
So Rhonda, she touches on a very important thing, which is the fault lines of the healthcare infrastructure. So the question, you can respond to her answer, but I want to just piggyback on that and ask you guys, how should lawmakers and public health officials and leaders across local government, how should they move forward in addressing these inequities?
Yeah, so I'll say one of the big causes that why we're seeing such high rates in our community is because of the essential workers. What we would call occupational segregation now is called essential workers, where we predominate, Black and brown people predominate in those service industries where there's a lot of contact with the public or interfacing with the public. Bus drivers and transportation sector and the grocery stores, home health aides. And so the more that you have contact with people, the more that increases the likelihood that you can become infected. And so we're seeing that across a number of different cities that we are, we occupy a number of these essential worker positions. We also tend to live in high density areas, which again increases the likelihood that you're coming into interaction with a lot of people. So high density areas, multi-generational families. Some of that is cultural. Some of that is also because there's an affordable housing crisis that we need to be together in order to be able to afford rent, in order to be able to afford a mortgage. And then, yes, we know that there are these healthcare disparities, right? Particularly, or healthcare inequities, particularly when we try to access that oftentimes we've heard so many stories, one too many stories really, of Black people trying to get care, having symptoms and being turned away, have gone in 2, 3, 4 times, and then dying a few days later or being hospitalized in the most severe cases of COVID-19. And so this is a crisis, a healthcare crisis that has been long-standing, and it's being exposed in a way that I think hasn't been exposed previously in terms of the attention that it's receiving, but this is something that we've been long aware of. Healthcare providers, Black public health folks have been, fighting against healthcare bias for decades, and so that's in part some of the reasons why we're seeing some of the high infection rates.
Yeah. And I would like to add that we've got underlying conditions that you hear about: diabetes, hypertension, cardiovascular diseases, obesity-related syndromes, which in fact do exacerbate an infection of COVID-19. But of course, the question is, why do Black people disproportionately have those underlying conditions? And I would posit, these things we call pre-existing conditions are really exactly what Dr. Lubin said. It's high density household. It's not having jobs where you can work from home. It's not having adequate employment. It's not having access to health insurance. There are Black people plenty who right now are afraid to go to the emergency department, afraid of getting COVID-19. So that means people who need to go because of their diabetes or their cardiovascular disease aren't going, and dying at home. So lawmakers could follow the guidelines, maintain the stay-at-home policy, because we don't need to reopen the economy right now, as we have seen, but also make sure that hospitals in or near low-income neighborhoods and communities have the kinds of resources they need, so that when people go there, they know they're going to get quality care. Medical mistrust is a real thing, and it keeps people out of the hospital, keeps people out of physicians' offices. And so if we had adequate care where people were, and of course testing, then we could do a lot to lower those rates and lower the severity of disease.
And when you think about the notion of what you just heard from two experts who understand the science, the disparities, the medical background of why this is happening, think about what we heard when coronavirus first hit. It's going to affect the elderly. It's going to affect folks who have pre-existing conditions, older folks. So for young people in this country, especially in our community, it was a narrative that, oh, you're young and invincible. Now realizing is that there are folks who are asymptomatic, who are carrying and passing the virus on to others, a lot of young folks, and the young folks who are actually being impacted. And so I think the broader question around how do you get younger people to really own this fight, we have to reframe what healthcare means in this country, because it's by politics and economics. It's driven by a different type of agenda than just making sure that we're healthy and that we have, physically we're okay. And so I would argue for organizations like the NAACP and our partners that we have to reframe and reclaim the narrative that this fight, Think Affordable Care Act, et cetera, is a bigger fight than just how do you make sure that young people care, but it's literally how do we make sure that the health of our community is a priority, and there's all types of connectivity to economics, to policy, and other variables that if we don't do the job of making the connections, you'll get a story like the coronavirus sort of rollout that, oh, this is affecting old folks, don't worry about it, go young and free, when in fact we know that that was a lie and not the truth, and now we're starting to see the impact of that narrative.
Yeah, Jamal, the thing that concerns me is back in February, it was, oh, Black people can't get COVID-19. And now it's, oh, look, it's affecting Black people. We don't need to worry about it. And so, what that could do to devastate our communities is really scary. When you think about, as you said, the economic impact, Dr. Lubin, yes, folks are anti-science, but people are hearing the science and just willfully ignoring it.
And data is really important because we need information to have a better understanding of how to combat COVID-19. My next question is, how can better reporting of racial data of COVID-19 cases better equip the government to address the racial disparity? Obviously, we have lawmakers who are pushing for this, but we haven't seen a lot of progression on this issue.
Yeah, that's a real challenge. CDC hadn't required reporting data until fairly recently. We've got race and ethnicity data on about 82% of cases, but we also know that the cases are probably underreported by about 40% or so. With adequate data, then you know where to do testing, where to do contact tracing, what sort of resources are needed where. But if you don't have the data, then you can't actually get what patients or potential patients need when they need it.
And we've been concerned about how the data narrative is playing out. And we kind of touched on that earlier, but it's that, oh, if it's Black folks in Detroit dying, and it's Black folks in Washington, D.C. dying, and it's Black folks in Atlanta dying, then that's a Black people problem. So then why should we, the rest of the country, care? Now, we know the man sitting in the White House uses that narrative a lot. And so we have been concerned and worried that the full breadth and depth of the response gets undermined when it becomes a Black, brown, working people problem. And so when we talk about the data, we also have to make sure that there's some guardrails in place on a political level that says this data can't be racialized and used to, pretty much put this epidemic on the backs of people of color and Black folks, which hampers their response. Now, I know you all know that that's a fight. Out there who literally that's going to be their narrative already. And so we've been prepping ourselves and our community members to say, don't let that be the line that gets drawn, because then what happens is it's business as usual, because guess what? This is a Black people problem. when we know that the virus doesn't discriminate. However, it does disproportionately impact us because of the things that we've laid out.
Mhm. Yeah, and I think another part of this conversation too is policing, right? What happens when Black people are associated with COVID-19? We saw just this past weekend in New York, there were pictures coming out in the West Village where there are white people close together, hanging out, no social distancing, and no policing of that setting at all. Meanwhile, a few miles away, we saw Black men being wrestled down in an attempt to get them to practice social distancing. So that's another thing that we really do have to be concerned about, particularly as we're waking up, today and yesterday with, two other cases of where we're seeing, white supremacist violence and police violence in our communities, and that there is a possibility, right, that COVID-19 being associated and the misunderstanding of the science and the data being used to harm us.
And Dr. Lubin, you raise a good point. What surprises me is that when you think about social distancing, why would a police officer or a first responder want to grab and touch on folks, knowing that they're then exposing themselves to something that we're all saying social distancing needs to happen? And so the notion of policing and it being racialized and folks turning off their logic button on their sort of racial prejudices doesn't make sense. I'm reminded of the quote, what Fannie Lou Hamer said, if you have your foot on my neck in a ditch, we're both in a ditch. And so when I see the officers grabbing and fighting with Black folks and people of color, I'm thinking you're not social distancing and you're actually perpetuating what could be the spread of the virus. So education has to happen in a very clear way, not only for the people, but for those who are there to protect and serve the people.
Right. Yeah, it's education, but we also have to realize, right? I mean, like how real we want to have of a conversation, right? Like that's the logic of white supremacy and racial oppression, right? Is to always try to control Black bodies, right? And so even in a pandemic where you would be trying to take precaution to stay away, to limit the amount of physical contact, we're seeing that there's a possibility that there's going to be an increase of that, an increase in the carceral state, threatening to put people in prison or in jail for violating, social distancing orders. Who's gonna bear the brunt of those types of policies?
It's amazing how racism can trump common sense.
Always.
Every single time. I want to talk about finding a vaccine. Obviously, the government, the private sector is trying to find a vaccine. We don't know when a vaccine will come, but how can you talk to our viewers about how important it is that clinical trials of a potential vaccine have a diverse pool of participants?
Yeah, that is really critical. When you look at clinical trials, let's say for cancer, about 4% of patients, which is in clinical trials. So if it's 4% of white patients, that's a fairly large number. If it's 4% of Black patients, that's a pretty small number. And there are very good historical reasons for why Black people do not participate in clinical research. I understand them fully. Yes, there's Tuskegee, yes, there's Henrietta Lacks, but it goes way back from the beginning. However, if we're going to have a vaccine or therapeutic that's going to work, we have to participate in clinical research and clinical trials. Right? We hear right now, every day, that there's 30 or 40 different clinical trials going on for therapeutics and vaccines. I would posit there are not that many Black people involved in them. So the Black Women's Health Imperative actually has launched with a grant, clinical trials training of the everyday woman, to help her friends, her sisters, her relatives understand what clinical research is and how to participate in it and be respected. And we're also training providers on how to engage Black women in clinical research so that they are valued and respected. This is going to be really tough, but we've got to do our part to make sure that the panel, the people who make up the participants in clinical trials, represent us, because what happens is you end up applying a body of evidence to people who had nothing to do with the creation of the evidence in the first place. And so we can't be sure that it's going to work for us.
And the irony of what you just said is we got reports from the ground of the CDC knocking on doors in Black communities, collecting blood samples. and people were triggered. They were upset. They were like, wait, is this Tuskegee syphilis 6.0? And then you start to read the articles and you hear from Mayor Keisha Lance Bottoms that this is a part of, again, developing a solution. And so how do we actually balance out our participation with our bodies in a system that sometimes abuses, and as we know under racism, deeply abuses our bodies? So it's a fine line we're walking, but to have experts and leaders who look like us really say, you know, in this context, it's okay. And let's figure out how to monitor and lean in is critically necessary, so that otherwise a lot of us are going to close our doors, lock our doors and say, not me, because I've seen what happens when we trust a government that doesn't actually respect and care about who we are fundamentally.
So imagine if we paid the laid off workers to do testing. It takes about 15 minutes to learn an hour to learn how to test, 15 minutes to learn how to do contact tracing, and paid them and deployed them in our communities to do that and collect data about what the impact of COVID-19 is on our communities, and then had researchers who look like us actually analyze that data. Imagine what we could learn if we did that.
Yeah, I think that model, the model that you're describing, Linda, is so important. We have to have people that look like us making the contact with our communities, and also leaning into the misinformation that has been circulating out here, because we're not going to get anywhere in terms of recruiting people for clinical trials if we don't address some of the misinformation out there, videos that have been circulating about vaccines, and that if you get a vaccine, it's actually going to give you COVID-19. So a lot of this misinformation is spreading, and which is furthering the mistrust and the distrust, and likely may also be preventing people from going to the doctor when they're feeling sick. So we have to, have a comprehensive strategy that really, looks at the historical challenges around recruitment for clinical trials, but also some of the information and the new or growing level of distrust in our communities in this pandemic.
So as we know, the world is ruled by money and by power. How has capitalism played a role in COVID-19, and how it's impacted Black Americans?
I'm gonna jump in here for this one, because it's been really sad to watch politics as usual from the wealthy few play out in this pandemic. And so I know I lifted up earlier a few senators who were selling off their stock in February before we even had a game plan for the community. But think stimulus packages. So stimulus number 3, which is called the CARES Act, stimulus 3.5, almost $1 trillion worth of cash was pushed out to stimulate the economy, businesses, small businesses. And what we saw firsthand was that 2/3 of the businesses who got that funding weren't actually small businesses. And a Shake Shack get $9 million. A small mom and pop business what that funding was intended for. What we learned is that 90% of Black businesses, 90% roughly of Latino businesses were cut out of that money and that funding pipeline, because banks decided, we're going to go for the bigger companies who have bigger fees. We make money. And then deals were cut, backdoor deals were cut, and our infrastructure is different, meaning 90% of Black businesses are sole proprietorships. Get pushed to, is this notion of, you need the $1,200, but that's what you're going to get, or maybe some unemployment insurance. But the real money, the big folks who have pocketed the real money don't like us. And that was a setup. And so now that we're looking at stimulus number 4, it's a fight on our hands, because we realize that this was business as usual for the wealthy few to say, the economy's about to be messed up. Let's grab some cash. And think about it. We found trillions of dollars all of a sudden when we find money to pay people $15 an hour through the for 15. So when we start to think about economics and the wealthy few and the divide in terms of the wealth gap, it is playing out literally right now during the coronavirus pandemic. And there are folks who are eating well, and the majority of us aren't. And so our advocacy now has to pivot to that, which is unfortunate, but it's showing, I think Dr. Lubin said it best earlier, it's spotlighting all of the stuff that we have been experiencing in our community and that we've seen in our community. And as I put it, when we think about new normals and new models, how do you make up a new model or a new normal in a crisis? How do you think about what we really need in a crisis. And so we really are being tested in a whole lot of ways as a community on the economics front, because it's business as usual for some folks who literally have decided it's going to be a money grab for them.
You know, it's like being on a boat and it's like all these holes and water is like coming out of the boat. You're trying to stop the water from getting in the boat. And it's like we're focusing on health, we're focused on the economics and who's steering the ship while we're trying to I messed up my analogy, but put out the fire. It's mind blowing.
Yeah, and I would add, right, we have to, like in this conversation, we're talking about how capitalism is showing up is, you know, we look at our healthcare system, we have a capitalist healthcare system where for the most part, if you don't have enough money to afford healthcare, then you can't access healthcare. So I think, and particularly now where we're seeing massive amounts of unemployment, so we have a system where your ability to access healthcare is largely tied to whether you have a job. Right. So what happens when you have 30 million plus and growing people that are out of work? And so what does that mean for your ability to access healthcare? And in a pandemic, you don't want people to be afraid to go to the doctor. And so but we know that if you can't afford, if finances are an issue, that informs your decision as to whether you end up making that appointment or not. And so I think when we talk about advocacy, right, we need to be thinking about, you know, how do we achieve a true universal healthcare system in this country, a system that's not based on your ability to pay, right? That's not based on class, it's not based on your race. The lack of paid sick leave, there's a temporary paid sick leave that came out of the CARES Act, right? But how long is that going to last? And so that's also, you know, a really important issue for us as well, right? That the majority of Black workers don't have access to paid sick leave. And so that's another area for us to be thinking about advocacy. Our essential workers, you know, why were they unprotected, right? The investment needs to be made to make sure that they have personal protective equipment and hazard pay. So they are out there risking their lives. And so the money needs to be spent. Health needs to be put above profits. Our essential workers need to have hazard pay.
And Jen, it shines a very bright light on who's considered to be valuable. I mean, economists are looking at this, and these decisions to reopen have come about because they've decided, well, elderly people who don't contribute that much to the economy are going to be the most effective. And we look at the Black and brown population, what is their relative contribution? And people are looking at the numbers to determine what the economic impact would be should X%, Y% die. What we know, which has been done in other countries, is investing in people, literally giving people cash, actually is the best possible thing to do for the economy, because, you know, a rising tide does indeed lift all ships, but you have to want certain ships to be lifted. So we could come out of this better. People talk about a recovery. I say it needs to be a restructuring. We could come out of this better if we're willing to put money where it needs to be. But as long as we look at people in terms of their relative contribution to the economy, then you get decisions like this, which are go back to work, and we'll just see how it plays out.
And the sad part is that narrative, we are still the largest economy in the world, in the top 10 per capita. But when you think about wealth distribution, the gap is huge. But guess what? If the folks who work in the meat factory, meat processing plants, the folks who transport our toilet paper, driving the trucks, the folks who are at the grocery, if they all stop working right now, we're stuck at home, suffering at home. And so we have to shift the paradigm around this narrative of, you know, again, the essential worker is also a worker that's underpaid, undervalued, not invested in, and they look like us. So hopefully, and I'm hoping this is my hope, my prayer, my wish, is that a lot of Black folks wake up and say, wait a minute, if they need me to go to work and they're paying me substandard wages, it's time to renegotiate. It's time to come out in a new normal. Because if we go through this hell and come out and ended up in the same hell that we started off in, we missed an opportunity. So that's, I think, the part of our fight is pivoting to a new normal. And I know I sound very passionate and emphatic, and it's because this doesn't make sense. And when we think about people dying and people's lives being on the line, I think of my 85-year-old grandmother who said, baby, I'm not willing to die for nobody's economy, period. And so when you think about it through that lens, she's lived a good life, but she got some years to go. So from that perspective, what does it mean to have a new normal economically is really going to be a test for all of us.
And one last question on economics. How do Black business owners get access to Paycheck Protection Program funds?
I'm gonna jump in here, and this is gonna be the worst answer ever. The Small Business Association is literally shutting down. The cash is gone. The money has been done. We were just on conference calls today about the fact that they have run out of money. There is about $1 trillion worth of requests for emergency loans through the EDIL program and the Paycheck program, the PPP program. That money is gone. Unfortunately, the money is gone. So what's left is unemployment insurance, which depending on your state, you may not even be able to get in because the phone lines are clogged and there's not enough folks staffing the unemployment offices, if you will. The second category is, and I'm not calling them what the White House is calling them, but these stimulus checks, there are folks who have gotten that money and realized that $1,200 or that $900 was spent before it hit your account. So right now we are in an economic crisis for a lot of folks who had businesses or have lost income because the stimulus money that was put out is pretty much spent. So now we're looking at stimulus number 4, which is coming up in the next few weeks. So we got to advocate not only for more money to be pushed into the economy, but carve outs that specifically say for Black churches or churches in particular, here is what it looks like to have a program for them, not for Shake Shack or not for the Lakers Association organization. So we're in this weird nexus. And I hate to be a bearer of bad news, but that is the facts. They have taken the money and run with it. And the majority of us are left, in our current state. So I don't want to give people or hoodwink folks to think there's a whole bunch of pot of money sitting over there waiting for them. Unemployment insurance is there. There's some states that have emergency funding programs, but a lot of folks are being steered now to food programs, like going to the school district to get food for your kids because that money is already allocated and there's food services there, or getting temporary emergency support through HUD for housing vouchers. Like, it's the crisis. So, Jaron, just to answer your question, they spent the money. So now we got to ask and fight for more and then allocate and try to fight to make sure it's carved out for our people and for our community.
Yeah, and to add to that is to look at the local level. There were some local governments that were offering loan and grant programs to small businesses, and so to look out for those types of programs as well. While the federal government's program has run out of money, to look at resources that might be available either at the local level. There are some organizations and grants. Some foundations that are offering some support to small Black-led businesses as well. And then I think it's to your point, Jamal, that we continue to advocate and hope that there is a fourth package that comes down that really, really puts that has a racial equity lens, that really directs the resources to our small businesses. And in the meantime, what is it that we can do as small businesses to prepare for when those bills get passed, that we're able to take advantage of those opportunities. I talked to lots of friends and family who didn't know about PPP, didn't know that they could qualify, that they could apply for it. And so having to coach people through that and letting them know, go ahead and apply, or that, yes, it's open for independent contractors. So there's a lot of also one-on-one and community education that also needs to happen, to help coach people and encourage people to apply. Because oftentimes we get shut out of these systems and then feel that we shouldn't apply or aren't going to be able to get the loan and don't even try. And so for us to be ready when these opportunities become available.
And this is where data really helps. If we've got data on what percentage of businesses by size, by ownership, by the race and gender of ownership, of location, actually got funded. I mean, we already sort of know anyway, but if we could publicize that, and to the points that have been made, massive advocacy behind that, so we can shine a very bright light on the inequalities of the distribution of this fund, which was expressly supposed to support small businesses, then we can begin to make the case and ask our elected officials, well, where do you stand on this issue? How can you possibly let this go in your state? Shouldn't you be doing something else? But it's going to take us getting that data and then raising our voices to make sure people know about these inequalities.
And Jaron, I would say that that's where news outlets and entities like the GRIO become very important to not only telling our story, but sharing the data and framing it in the right way for our community. Because, you know, to Dr. Lubin's point, there's a lot of folks who weren't even ready when they said you got to have their tax papers ready in order to get some money. And so how do we get folks educated to know what's happening, but also to show, hey, there's a disparity that's taking place. And so we need more of the real newsmakers and news providers to share that information, because otherwise the story gets lost, the narrative gets lost, and folks are stuck in a place of confusion, and then they never get the services and help they need.
And thegrio.com is committed to sharing that information, and I'm making that commitment right now live with you guys, that we will continue to push out this information so that Black Americans can know how to empower themselves during this time, which leads me to my next question. How do Black Americans empower themselves in a time where they kind of feel powerless?
Well, that's what we're hearing. You know, we're hearing part of what the go back to work, you know, doing something other than staying at home is people are just worn down. They're fatigued. They are just over this. Yeah, and I'm talking about people who have the ability to do this, who have the kinds of jobs. People have grown weary of this. And, you know, as you look at the news, not the GRIO, but other news outlets, and see what's being reported, there's no reason to be hopeful. I mean, there's nothing in what we're hearing, if you're looking at some of these broadcasts, that would lead us to believe that things are going to get better. So if you know, I'm sure if my mother were here, she would say, we've got to go back to remember what it was like with your grandmother and what your grandmother and your grandfather used to talk about, and how they used to talk about the community relying on each other and depending on each other and needing each other and treating each other like we're all that we have and we have to do it ourselves. I mean, I think we're kind of getting back to that point. You know, I mentioned this is not a recovery, this is a restructuring that needs to happen. And so we're going to have to look at those levers that we can pull and come together and do that and work with partners who see it and understand it so that we can make that happen.
And I would argue that, and this is a real call to action, I think, for some of us who have more resources, that we have to commit ourselves to saying that we're done dying, that we are not going to sit back as business as usual. And I'm talking about my own organization. The NAACP has a lot of infrastructure and a lot of folks and members who are doing well. So these are the folks that have to act a fool now, fight for more resources, tell the story, and really push ourselves to a new normal. And I'm talking about organizations like the Links, who we're partnered with, the fraternities and sororities. There's a whole lot of power in the Black community that if we coalesce around the reality that, guess what, this moment can't just be business as usual, then that's where we operate from a place of power. Because I have relatives who, to be honest, they still got to go to work. They're still struggling to make ends meet. They have kids at home. If you have 3 kids at home and you're supposed to homeschool and you got to go to work and you got 1 computer, you're underwater in a different way. So I have to fight for them in a way that I've ever fought for them before. And so I think in this moment, there's a call to action for some of us in our community who are better able to a different job, a bigger fight, and to really make sure we're pressuring our elected officials. And if we have the information, create spaces where we end up being the solution. And I know that sounds a little corny, but that's the reality. Because if we don't, then the folks who really are underwater, the folks who are really struggling, it's going to be hard to expect them to fight for themselves and climb out of a ditch when we already have a leg up. So for me, I think that is the clarion call from our president and CEO, Derek Johnson, from our organization. If you've got a little bit of money and a little bit of resources, you need to be fighting like never before for the rest of us who don't have as much. And so if we can get to that kind of pivot, I think we're going to have a new normal once we come out of this thing. But if not, then it is business as usual.
Yeah, I really like that a lot, Jamal. One of the models that what I've been affirming in this pandemic is care for self, care for family, and care for community. And when you think about care for community, there's been some bright lights, right, in terms of some of the mutual aid networks that have emerged across the country, Black people pulling together resources, in order to make sure folks aren't hungry, if you need help with transportation and things of that nature. And so how do we build on that model? And Linda mentioned, right, it's that reconnection to basic family and community care. So that's what I find exciting and empowering in this moment. And while I am able to shelter in place and be safe, is what can I do? How can I use my voice? How can I pull people together? How can I pull resources together in order to be able to respond and care for our communities in the ways that our communities need to be cared for, in the ways that our communities need to be uplifted and our stories need to be told. And so I think it's so many ways. Sometimes we think we are powerless when we are not, right? Like that sometimes it's a phone call, sometimes it's an email, it's a post, it's a donation that really helps to that you're able to contribute and really help support a broader movement.
Awesome. I love this discussion. It's so engaging, and you guys are so passionate about this, which is what I love. We're wrapping up the conversation, but I do have one last question from Stacy on Facebook, who says, so what are we going to do to round up resources and demand more testing?
I think it's that. It's demand more testing, and it has to come from government investment. I was just talking to a friend of mine a couple of days ago in Philadelphia, where they're trying to get donations together for testing. And I said, that's great and that's important, but that's actually the responsibility of the local health departments. Local health departments need to receive funding from the federal government, from CDC, to be able to implement testing and to do wide-scale testing in our churches and faith institutions, libraries, pharmacies. We need widespread testing, and as much as possible throughout our communities and neighborhoods. And it should not rest on the backs of donations from private individuals. And so I think that's really critical for us in terms of advocacy, right? That this is the responsibility of the government.
We've got to tell our stories and get our elected officials to do their jobs.
And I would say, if you are not connected to some type of organization locally, hyperlocal, your church, get connected to an entity that has other people who are like-minded, and then do what Dr. Lubin and what Linda is saying is demand that your local government, your state government, and your federal officials actually meet the needs of the community. When Jaron talks about being on a boat with a whole bunch of holes, some of us can start plugging those holes by advocating. So if you're passionate about education, make that your fight. If you're passionate about healthcare, make that your fight. If you're passionate about the economy, make that your fight. And I know that that's taking on a burden, but that's actually the only way we're going to get through this, is if folks really elevate and raise their voices, because they can find the money. They can find the resources. And when I say they, I'm talking about the federal government. We elected these folks to make choices, and they're picking and choosing how they do business. We have to now demand do business this way, because that's what we need. And I think at the end of the day, us being in this sort of connected space matters. I know for my organization, if I didn't say go to our website, naacp.org/engage, I'd be doing a disservice to somebody. But if you don't want to play with the NAACP, there are other organizations out there that you can plug into and other networks. Use your voice, but advocate. Because if you think my dollar and your dollar is going to fix it, that's one part of it. But the bigger part of it is making sure that the federal government closes the gap, spends the resources, and invests not only in testing, but in economic programs, education programs, the things that we're going to need to get our people out of this pandemic.
Amen. The power is in each one of us, and the power is also in strong numbers as we band together. Thank you guys so much for joining us for this conversation. It's been a wonderful discussion. Thank you all guys for viewing this conversation. If you want to hear more about this, if you want to talk more about this conversation, head over to healthcarevoter.org/story. On May 11th at 3 p.m. Eastern, we will hold another virtual town hall focusing on Latino people and the challenges that they are facing during the pandemic. If you'd like to join that discussion or that town hall, please visit our lives ontheline.org and RSVP. Right now, immediately following this town hall, you're welcome to join us for a post-town hall debrief at healthcarevoter.org/debrief to continue this conversation and speak with other members of the Healthcare Voter team about how to get involved today. Again, that's healthcarevoter.org/debrief, or you can find the link in this live stream's post description. We've got a lot of work ahead of us to protect our healthcare, lower our drug prices, and expand access to life-saving treatments and bolster the American healthcare system. And I'm confident we will emerge from this stronger than ever because we're fighting for the right things. Thank you guys for tuning in. Have a beautiful day and take care of yourselves.